NetsChat.
Hey guys, welcome back to another episode of NetsChat. We are in week 3 of our new series called Sex Miseducation, where we basically just debunk rumors and everything you guys have learned about sex and try to give you new information that you can hopefully...
That is accurate.
Yeah, accurate information and information that you can use to better off your sex life, of course, and your health. Hi, Danielle.
Hi, guys.
Okay, so for our third episode, our guest is Kiri Bridgewater. She is an obstetrician and gynecologist. Kiri, can you introduce yourself to our listeners?
Sure. Hi, guys. I'm Dr. Kiri Bridgewater. I'm an obstetrician and gynecologist, and I'm just here to just get to low down on all the things about miseducation that we know in Jamaica.
Okay, awesome.
Okay, great. I was distracted for a moment.
That's fine.
So
it happens.
We're going to talk about vaginal health, and my question is, should women put, it's on my chest, should women put garlic pegs in their vaginas to balance the pH and minimize yeast, like if they have a current yeast infection?
All right, so I get this a lot, and no, it's not actually recommended. So, the first and foremost, garlic has a lot of benefits, right?
Mm-hmm.
I'm not knocking garlic. I'm not knocking the great health benefits that it can give. And in truth and in fact, there are certain dietary changes that you can make to help with yeast infections. But this whole thing about putting a whole clove of garlic in your vagina, listen, I beg you don't do it. Yeah? Because it's not once or twice patients come to me and I can't even find it back. The garlic is there for days on end, weeks on end. And when you have something like that inside of the vagina, it can actually make the situation way worse than it needs to be. So you can eat it if you really want to, but I would definitely recommend other things instead.
What do you mean stuck and can't find? I think that's where I'm lost.
That's where you lost me, because I don't know if you realize the whole change in my face.
Everybody stop.
I don't want me to shock you, but yes, people have put up garlic cloves before. I mean, I have some patients that have now learned about you drill the garlic and you put a thread through it so that you can find it back when the time comes. But some people don't do that and they actually just place the garlic clove up. And I don't know if you noticed, but your vagina is like a maze, right? So it's very easy for it to be caught behind your cervix or something like that. And so when you're digitally inserting your fingers to look for it, can't find it back. And it's just stuck.
I'm not loving that. I mean, I wasn't planning to do it before, but no, worse. No, that was actually kind of scary. Can't find it back. So then what next? And then they come to you and then you...
Yeah, so they come into the office and I'm able to look and use the speculum and look and see and remove it. But honestly, it's not worth it at all. There's so many easier ways to get rid of a yeast infection and ways that actually work.
That's true.
So in terms of getting rid of yeast infections, well, there's some preventative things first and foremost, right? Mm-hmm. Because dietary stuff. So drinking lots of water helps to prevent yeast infections. Also eating yogurt helps to avoid yeast infections, and it can even help you if you have a really mild case as well. And I'm not talking like the sugary, super sweet one. I'm talking like plain yogurt, Greek yogurt, things like that, right? Mm-hmm. Additionally,
Greek yogurt tastes bad. I'm gonna just say that.
It does, but you ever taste good medicine yet?
Good point.
I mean,
we took the point.
It works, right? If you really have a version to it, you can put a little honey in it, or some of them come with a little mix with the berries and stuff to make it a little bit more palatable. But those are the ones that work a little bit more, and they're better than the others. And the reason for that is because yeast loves sugar and it loves dairy. So if you find that you're prone to yeast infections, one of the best ways to try and cut down on that is to cut down on those things in your diet, which is part of the reason why sometimes women will say, "Lord, doc, every time a period come up, I get a yeast infection."
I've heard that.
Yeah. And it's actually linked to our changes in our diet, because when your period come up, that's when you feel for something nice, That is when you want one bag of chocolate and all of these things.
The brownie brittle that is plaguing my life has something to say.
What about after your period though? Because some women, like immediately after they have their cycle, then they do get a yeast infection,
Right. So some people actually get yeast infections afterwards, and sometimes that can have to do with the excess moisture, because that's another thing that yeast loves. So that's why you'll find that if you go river or you go beach and you sit down in your swimsuit, or if you go to like the gym or something like that and you take too long to change out on a regular basis, you'll realize that you get a yeast infection. So similarly, because the period is flowing and there's all this excess moisture for a couple of days worth, sometimes that can predispose people to having yeast towards the end of their cycle. And sometimes when people say that, it's actually not really yeast. Sometimes it can actually be bacterial vaginosis, because that's the one that you get when your pH is kind of thrown off. and your vagina is normally acidic, but the blood in your period is actually alkaline. So that passage of blood over that prolonged period of time can change your vagina into an alkaline environment and therefore give you BV.
I'm so surprised.
Oh,
like my shock level just went through the roof.
Well, y'all are gonna get a couple memes from my face.
Oh dear.
Like,
I mean, they leave with knowledge and they leave with
memes.
But I think I heard like some time back that if you incorporate like cranberry into your diet, then it can limit yeast infections, or that's just like particularly geared to UTIs.
So cranberry tends to be more geared towards UTIs. But it also has lovely antioxidant properties, so you really can't go wrong with it.
You can't go wrong with cranberry.
Yeah, but true.
I know about it. Because I was in the pharmacy one day and this girl came in, which I found out that they don't have like any over-the-counter treatments for a UTI, which I think is kind of bad because
a UTI is but I don't know. If I ever do, I just drink the juice.
Cranberry juice and water and flush your system.
And I just take like a flush, like, because I feel like there's some times where like you can tell like from earlier on that this is about to happen to you or no. Yeah, so then I just start drink my...
Definitely, especially if you're in tune with your body, you'll be like,
you just know that something is off. You just go drink, man, Team Ocean spray. But yeah, because there really is no over-the-counter, as you were saying. There's none. Tragic. And when you go there, the pharmacist just going to tell you, buy some cranberry juice over. So yeah, man.
But the girl, when she came in and the pharmacist told her that there's none, she started walking out. So I said to her, me and this other lady said that just buy the cranberry juice.
So you were listening to the girls.
The pharmacist was very small.
You know the girl business.
Like, no, because at first I thought it was a pharmacist tell the girl that, and then I'm following up and I'm like, it's you first?
No, it's not. Let me tell you what happened exactly, right? So I was at the cashier and the pharmacy was right beside it.
Oh,
so she was talking loud and the pharmacist was also talking loud.
They both helped.
So everybody in the pharmacy heard,
So everybody in the pharmacy,
right? Yeah, but she seemed like it was very urgent. So I'm like, all right, here what? I'm not really in the girl business, but I'm a helper because I've been there.
Each one help one,
you know. So we were telling, and she was like, "Really, this work on me?" I said, "You know, people don't really know enough things." And so when she was buying it, the pharmacist said, "It's not really gonna help you right now, you know.
You have to drink a lot, you know.
You can do it. I know, but
me not mind. Me love cranberry juice on a regular basis
with no solution, right?
To send her home for go sad
and die, cause
wow, that you said.
Suppose you can't manage it, right? Anyway, so. And thing that's like hitting the markets now is the yoni products. A lot of these businesses popping up. Yeah. So I think I've asked you this like personally as well. Are these steams, detoxes, and like I think it's called boric acid,
and the pearls.
The pearls are they safe to put in the vagina?
All right, so here's the thing, right? Your vagina is super awesome. Like, it is excellent at sorting out itself. Ladies, your vagina, you don't even know how awesome it is, all right? You don't need to be putting anything in your vagina or detoxing your vagina or anything like that. Focus. Let's talk about your lady part.
No, I was so confused. I'm like, is Martin?
I'm just teasing. Yes. But yeah, no man. So you really don't need to be putting any of these things inside of your vagina. Additionally, it can actually cause more problems than solve. So if you actually check out the yoni pearls, a lot of them have this clothing thing on it. And the truth is, your vagina doesn't like foreign bodies. It don't like not supposed to be, doesn't belong there. And so by putting these things inside of it, you're actually going to increase the amount of inflammation, increase the amount of discharge that your vagina produces, etc. So that's in terms of the yoni pearls. And even when you read like the instructions, sometimes they say, "Oh, your discharge is going to get worse before it gets better." Oh, comes.
No, I can't do it.
Oh, comes. That don't add up to me, you know. Additionally, in terms of the boric acid, in theory, your vagina is acidic. So by putting boric acid, by putting another acid, it should help your acidity to be stabilized and therefore help against things like BV and yeast, etc. Problem is, boric acid and a play acid. It's actually a very strong acid. It's actually used in insecticides. So it used to kill roach and them things there, right? So when you put something as harsh as that inside of your vagina, it can actually irritate it more than help. Now, I definitely know that sometimes the treatments, especially the ones that the doctors give, I know patients have recurrent infections and it's a hard thing to deal with when you go to the doctor, you spend your money, you get a little relief, and then it come back again, etc. Especially because a lot of the times we're not really dealing with the underlying problem, like the lifestyle problems, the things that are putting you at risk for these things to begin with. And so everybody's turning towards these things right now. And for some of my patients, it does work. I can't tell a lie. But most patients, the majority of my patients actually have more problems. I've had patients come in with complications from these things. So I understand the appeal of trying them, but from a scientific standpoint, I can't recommend it.
Like personally, I don't feel like a lot of things should be in my vagina. So like when these things pop up, I find it interesting, to look at, and people are swearing by it. When cookie wash craze was a thing, and everybody was just washing. And I have a friend who, had, we're not friends anymore.
The way you say these things are so depressing.
She was swearing by these washes, and she was like, you should, use these washes. And I'm like, I don't.
Yeah, but there's other women who will like promote these things so rough, like you'll be just having a normal day and somebody be like, you try this wash, you should be using it, and if you don't use this wash, it's gonna be happening to you.
And you don't put everything in the vagina.
No, but I just find it so strange. But it's things that they swear by for whatever reason. I don't know. Maybe it really works for your friends. Cookie.
So a question that I got on Instagram. So the person said, "Isn't soap good for your vagina?" I hear too many women say no. So since we're already talking about like
washes and stuff.
This person thinks that soap is good for the vagina.
All right. So part of the problem we have here is that we use the word vagina very loosely, right? When people are talking about vagina, a lot of the times they're talking about the outside and the inside of your vagina. But the truth is your vagina is only the part on the inside, right? The outside is what we call the vulva. So that's what you don't normally call like the lips and stuff like that. And the top on part, that's called your mons, right? So soap is excellent for those areas because if you look on it, it has skin just like everywhere else on your body. So just like how the skin look on your hand, that's how it look down there. And so you need to be using soap to wash those areas. So you need to use soap on the outside of the vagina, in between the lips, stuff like that, to clean that area, because that's skin. And skin will sweat, skin will have release different things from the glands, etc. Now the vagina is actually the pink part, right? So everything that's pink and goes upwards, that's your vagina. And you don't need no type of soap in there. You don't need to put no finger in there for wash out. You don't need no rag. You don't need nothing like that. In there will sort itself out on its own.
But, okay, so when I was growing up, my stepmother told me that you're not supposed to use soap down there like at all, right? Because, even though, you're not intentionally trying to, wash inside your vagina, when you do use soap,
you get soap in there.
You get soap in there, and then that way it can cause, like, what does soap do? Because I don't want to say it can cause
I don't want, it's like, I guess it throws off your pH, I'm assuming.
Exactly, that's what it does. It throws off your pH. If you put stuff inside, like soaps inside, it will actually kill off the bacteria and throw off the pH, because you actually have good bacteria inside the vagina. If you're
washing in there, then it's going to throw everybody off.
And soap no partial, it's going to kill everybody inside. Yeah.
That's funny. Speaking of, so the last episode that we had, we were talking about fingering. And so a lot of women don't like it, but men didn't know. And I saw a video, I think, on YouTube one time where somebody was saying that, she don't like people putting fingers inside it. But some people swear by it. But are there dangers in, somebody putting their finger in you?
So in terms of danger, so anything you insert into the vagina, you have to make sure it's clean. Whether it be a toy, whether it be a mouth, whether it be a finger, it no matter. It have to clean, right? So I said, no, but it's real tough.
No, you said mouth, how mouth going to fit up there? That's how I was saying.
Some people try.
When you put your mouth,
like a whole lot of I try. Let's press on. But yeah, so you want to make sure that your fingers are clean. And the truth is, that comes under now the context of foreplay and sexual health. And there's no problem with having fingering done. It's just making sure that, one, the fingering is done with a clean hand, and two, that it's actually enjoyable for you. You have to make sure that this is something that you're finding beneficial for your sexual gratification and things of that nature.
Just make sure it's clean.
Yeah, just make sure it's clean. Just like your toys and all those other things, just make sure it's clean. And you're good to go.
There we go.
Okay. So let's say earlier you mentioned that there's like, you can sweat down there and stuff, and that causes like infections. So how does one reduce like the sweating if they do sweat down there?
So the thing is, it's skin. It's kind of hard to sort that out, It's going to be skin, and as it has hair follicles, and so sweat is naturally going to come from down there. There are certain powders and things like that you can put right on the months, not in the vagina, but on the top part where the skin is, to try and help to absorb the sweat, just like how you would normally put something to absorb the sweat under your underarms and stuff like that. But outside of that, it's going to be a little difficult because it's skin, and that's what skin naturally does. Naturally lubricates itself, naturally produces fluid to keep the area at a certain temperature and a certain moisture level.
Okay. I hope you guys learned from that, because that was a very popular question on Instagram. Yeah, so they want to know how they can like reduce the sweats and stuff. Sweats. That's funny.
Yeah, right?
Sorry. It was just really funny. Okay, so okay guys, so we had to take a small break, but we're back now. And the question that, another popular question from the Instagram story that I posted was, what's the difference between endo and PCOS?
All right, so endo and PCOS are kind of completely different things, to be honest with you. So PCOS is a hormonal issue, right? And just for those that don't know, PCOS stands for poly, which is a lot, cystic, which are fluid-filled sacs, ovarian, because it has to do with the ovaries, syndrome. So it's called polycystic ovarian syndrome, okay? Now, PCOS is when your ovaries have a ton of little follicles or little cysts in them, instead of creating one dominant cyst that becomes an egg. So as a result of that, you fail to have the hormonal fluxes that you should normally have with your menstrual cycle. And so that's why patients with PCOS will say that, they have irregular periods, or they have these long periods where they don't see their cycle at all, and then the lining suddenly, the period suddenly comes and it's for a prolonged period. But because of those hormonal changes, they actually get hormonal changes all throughout their body, right? So it can actually affect like the way your body breaks down sugar. It can affect your insulin production, etc. Whereas endometriosis is more of a structural problem, whereas PCOS is a hormonal problem. Endometriosis is when the lining of your womb, which we call the endometrium, which should be on the inside of the uterus to shed at the time of your period, it actually ends up deposited elsewhere in your body. So it can be deposited in the inside of your stomach, can be on your tubes, can be even in your lungs sometimes. It's really weird, right? And because of this excess lining, just like when you have your period, your lining on the inside of the uterus normally sheds and the blood comes out. In those cases, the lining still sheds, blood still comes around, but instead it can't come out of your body. So it stays in that area and causes irritation, which is why patients with endometriosis can have such severe pain. And pain is the main hallmark feature of endometriosis. Because when that lining starts to shed and that blood accumulates on the inside of your stomach, it irritates all the organs in there, and it irritates the lining of your stomach, and you get these terrible, terrible period pains. And this period pain can even happen from a little bit before and after. And it can cause scar tissue, which is why they then, if you have it long enough, people will be like, oh, I used to have bad period pains, but no, it doesn't even have to do with my period. Like, I just have pain at this point in time. And that's because it's caused scar tissue on the inside of the stomach, unfortunately. So that's a synopsis on PCOS and a synopsis on endometriosis.
Okay, so the thing is, a lot of people did think it was similar, because I've heard people also say that they've had endo, I'm not sure to pronounce it because I'm slow, and it gave them PCOS, but now that you're saying it's like structural and hormonal, do you think it's possible though that it can?
So based on the studies we have so far, we haven't found a distinct link between them. What I will say though is that culturally, we've become more aware of these diseases in the last couple of years. Definitely. So you find that more people are being diagnosed with endometriosis than like 10 years ago. Back in like our mother's day and our grandmother day, they'd be like, I just period pain, suck it up, kind of like. But now we're becoming more sensitive to the fact that, no, this is not normal.
That's true.
Something needs to be done. You need to get checked out. And as a result, people are being diagnosed more. Additionally, PCOS is also something that's becoming more people are becoming more knowledgeable about.
Definitely.
So as a result, I think more people are getting the diagnosis. And unfortunately, a lot of young women have both. And so they're like, how did these two things happen? But a lot of times it's just coincidence, actually.
Oh, I really didn't know about PCOS before knowing you.
That's true.
At all.
A lot of people
and then I found out about endo from a girl that I follow on Instagram, and she would like document her experience always having to go to the hospital around that time, and how, you know, it takes a toll on your life, always having to, because hers is pretty severe, of course, of her being in the hospital and stuff. And I was like, wow, it was really intense.
Yeah, because I've heard like accounts from women where they even just black out from their pain.
Really?
And they just thought it was really just severe pain. Up to now, I don't even think the person probably even looked into it. They just thought it was just cramps.
No, if you have pain bad enough that you are blacking
out,
if you have pain bad enough or you are vomiting because the pain is that bad, no, sweet girl, that's not normal quality of life. You need to look into that because there might be something there. And it's important for us to not be afraid of going to the doctor, because finding out these things and having a diagnosis is not the worst thing that can happen to you. Suffering for 20 years is what the worst thing that could happen to you. If you get the diagnosis, at least we can try to do some intervention to improve your quality of life, and so you can move forward from it, you know?
But the thing is, Jamaican people are genuinely afraid
Caribbean
of going to
people,
the
I
doctor.
think, don't like the doctor. I mean, I'm in the group. I'm in the group. Like, I'm not about to be here and speak third person. I don't like going to the doctor.
Why?
And if I'm going to the doctor, somebody have to carry me.
No, man, you're hurt my
Period.
feelings. Oh my God.
If you're my friend, boyfriend, or my cousin, you've taken me to the doctor before. I need somebody there for me. I don't know. Sometimes I'll be at the doctor, Nathaniel, and I'll be like at the gate. And like my doctor's assistant knows that I'm on a job. So I'll be at the gate for a while and they'll be like, just come. I don't even want to go in there.
Why?
I don't know. I don't know which doctor hurt me. I don't know, but I don't enjoy going to the doctor. It makes me scared. I start to scream and stomp my feet from outside. And then when I get in there, I get in there, my doctor stops whichever patient he's speaking to come and tell me, remember, you're not dying, which is something that he uses to keep me going. So my doctor has to be like, remember that you're not dying. And I still come to you. He will stop whoever he's talking to tell me that I'm not dying and I just need to sit down patiently. And in those moments, I'm there thinking about who I'm going to wheel my stuff to. Because if I talk to the doctor, I feel like I'm finna die. I hate the doctor.
Same across the room, you can die.
Hate the doctor.
What?
Sorry.
No.
I'm sorry.
I am hurt. Real tear. No, I'm hurt.
Listen.
I think I'm the absolute opposite of Daniel.
I'm glad to hear it.
No. If I'm walking, I'm start feeling lip, I say,
no, let me tell you, I hate going to the doctor. However, you know those people who always have to go to the doctor because they want to see them dying? I still go in, you know, because I don't have no sense. Because I always think, because I always think I'm
drama.
Yes, and then I go and act out the drama.
To do for go, but you love to go.
I have to go because I always feel like I'm dying. So if I'm here today and I cough, Nathaniel knows this though.
Then he had gas and she was freaking out. So
I thought I had corona.
Yeah.
I had gas and I thought I had corona, and I called Nathaniel in the middle of the night to spaz out because that's the nut job that I am. So, yeah.
Ladies, there's nothing to be afraid of. All right? Doctors are not here for any bad thing. Do not be afraid of going to the doctor. It's very important.
My friend said, don't like doctor because doctor tell us something wrong with you.
No.
He said, rather not know.
My doctor had to coach me through my pap smear days before, telling me that I can manage and throughout the whole thing.
You can though. It is nothing.
Huh?
It is not big, ma'am.
Where's that?
I have to have mine too. What?
Where's that? Me due for going for one. I mean, if you come,
me and you go hold hand and go then. Cause what is this?
Wow.
Hold on. One time I went to do my pap smear. I don't know if I did tell you. And I was just sitting there and I'm like, am I really gonna do this? And Nathaniel, when they were just about to say, Miss Ashu, I left. I am deathly afraid. And I sat there, Nathaniel, and waited. And when they called my name, I ran. I think I went to TGI. No, I think I went to TGI after. I'm deathly.
No, she's so surprised. Then he's
no, man, I'm shook. I am shook. Shook.
No, and that's how I know I'm really afraid of the doctor, because Nathaniel, who's going to go somewhere and wait? And then when them call your name, you're escaping and nearby bushes. Like, who does that?
No, but what are you afraid of for you? Dying?
To be continued. That's for another episode. Okay.
Speaking of pap smears though, I feel like that's very important, and I don't think a lot of people talk about it enough.
It's very important. Even me, Ufred, I tell you no. Right,
that's true. I've only done one in my life still.
Very important.
How old are you though? 23.
23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23. 23.
We're going to talk about that after.
But hold on,
No, okay, the one I did, I was afraid to do it after that because something bad happened.
Me too. So I've only done one, two, and I'm almost 40. So I've only done one.
I just said, no, I'm just not going to do this anymore. Because, okay, so I went to the doctor. I was so happy to get the pap smear because I was like, big girl now.
Yes.
And I did the pap smear and I was like, am I to school? And like when I left, my period came the next day and I was like, yeah, I'm so excited. And I didn't stop doing it until January and I did my pap smear in August.
But that is more likely because of a PCOS as opposed to the pap smear though.
But remember, it's going to be a trauma in your mind though. Even if what you're saying is logical,
connected.
it's the trauma for me.
When I mean every day, and then I went to the gynecologist. I went to the doctor again, and they were like, we don't know. So I switched doctors.
I hate when the doctor said them don't know.
Yeah.
No, all our doctors are people too, you know.
That's true. But me unfair bad. But I can't hold on to a different standard. I don't forget no.
No, she was genuinely confused as to what was happening to me. And then, so I said, I really have to go to somebody else. So I found like so many doctors. And then I was like, I have to just pinpoint one. No, so I went to one. And then I think like, she gave me a medication like 2 days later, I stopped bleeding. And it just never happened again. So I associate that, I associate that with my pap smear because I'm like, what did this doctor do to me?
And my pap smear, they used I think he used the wrong thingy. And then he's like, 1 sec. And then, taking it out to go use the other thing. I remember saying it's already an uncomfortable experience. So then I technically papped that smear twice. So, so the trauma. Then, when I did my pap smear, guys, there was a holiday coming up. So, that on holidays, the labs don't work. So, it took me maybe a month to get my results and kill me dead. I have cervical cancer and they don't know how to tell me.
No, I thought I did.
Every single day, I'm calling my doctor on my lunchtime. What happened? He's like, hi, Danielle. It's not here yet. He's like, it was just a holiday. Just give the lab some time. He was very calm. Am I gonna die? Anyway, then when the results came and I went there, of course, my bring crowd with me because as I tell them, I can't go by myself, I'm gonna drop down and dead. Go there with my crowd now, forget the little results. He's like, okay, everything is normal for the most part. What is it? What I say? The ear lock off. I'm telling you, trust me. The doctor.
My doctor did it to me the other day. She was like, everything is good, however. And I was like, you can't do that.
You can't do it.
It's not that serious. And I'm like, but you said, however.
Yeah.
So how can you not?
I'm going to say it's not serious because my doctor was like, when I said most part, I mean like, really, you're good. So I'm like, lead with that. How about you lead with that don't have cancer? So he's like, you thought you had cancer? Like, he was so confused. He's like, that's what you really thought this whole time. I'm like, kill me dead, me home with cancer and I have like 2 weeks to live. Couldn't you have called me? He's like, but then it's not me that the results. I was waiting on it just like you. And I'm like, God had me thinking I was dead.
You guys need to start emailing people those stuff because
like, can I
don't
have a
call
support
me in
group?
to see my results. I don't like it.
Oh, no, I normally text or WhatsApp patients or call them and be like, hey, you're good. I did one earlier before we started the podcast.
Oh, that's good.
Oh, that's good.
The thing is that, when you're in America, they don't... If they don't call you, you're good. But if they do call you, you're bad.
No, but I don't like that system, I know once or twice or thrice, I hear people say, oh, I'm going to do pap smear. I'm like, so what was the result? And she's like, oh, they never call me. So I'm all right. I said,
no.
Ma'am, I said, you trust, did you say? You trust Flo? How much time you call somebody on the phone, the call not go through?
Right?
That don't mean say you did all right. I say you pay a good money for your test.
I have to know.
You have to know your result.
I have to know your mad.
You have to know your result. Good or bad, you have to know your result.
I hope I live to see express pap smears
because that is a part of the problem. It does take a little while.
That express result. I could have was about my something.
No, it's not yours. It's not yours. Pap smear take that time to begin with.
Okay, so now that we found out that both of us only had one pap smear before.
But that's going to be rectified after the podcast.
It will be rectified because I've been saying that I need to grow up and just go do my next one. The thing is,
who should have a pap smear? Because when I was younger and my mom did her pap smears, I was like, what are you doing? Like, she was always, talking to my dad about it. And I was like, once every year, my mother is always like,
my mom always did hers on time.
And look at, oh no.
I was like, right.
And
I'm like, what are you doing? She was like, I'm just checking my cervix. And I say, well, my cervix not checked. So at first, I thought I wanted to do the man. She's like, you're too young. So is there like a specific age? And then like I hear, because my friend, somebody that I know, I'm correct myself.
Oh, you took that back real quick.
Yeah, always taking it back. She's not like sexually active, but she wants to do a pap smear. So that's what I'm saying. Like, is there like a criteria of people who are supposed to be doing
it or
right, certainly. So the old logic actually used to be like, it starts at 21 years old. But the ministry actually, because I went on their website the other day because I was doing a Q&A and I just wanted to make sure my information was correct. They are actually now saying that we should start at 18 years old. And the reason for that is I think our age group is actually becoming more and more sexually active, more at a younger and younger age. So they're actually recommending now that we start at 18 years old and you're supposed to have it yearly, right? If you're between a certain age group and you've had multiple normal pap smears, you can start stretching it out beyond that, is what the recent recommendation is. But for right now, I would recommend yearly because most people, hint, don't actually come yearly, truth be told, right? But in terms of the actual pap smear itself, what it really does, like a lot of people are like, oh, I don't want to hear someone have cancer. So pap smears are not actually done to detect cancer, really. Yes. They're actually done to prevent cancer, is the truth of the matter. Because the cervix actually undergoes multiple minor changes before you reach to a cancer stage. So when you're doing your pap smear, you're trying to make sure that your cervix is either one, perfectly healthy, or two, it has had a minor change so that you can kind of nip it in the bud so it never becomes cancer.
Okay.
You understand? But for the record, Danielle, the 4 weeks thing, I know you. I just saw it go.
Yeah, I mean, but trust me, that's enough time for your mind to make you think that,
I feel like these things need to be faster for you. Not only like pap smear, but like every blood test and them stuff. Because basically by the time them call you, you drop down,
No, like I hope to God, like to be honest, I've been very lucky. I feel like I'm a very healthy person, and I think it's because God knows that I'm a mental case. So him nobody gonna give me no sickness because me. Daniel, I can't take stress right about now. I only have eczema and that alone beat me bad. I can't take life. I can't manage. How am I going to do my little skin something then I stress out? Can you imagine me actually sick? I can't manage with result, girl.
No, you have to get your life together.
Sure. Oh, just to mention though, sorry, but you mentioned about your friend with the not being sexually active. So if you're not sexually active, you really don't need to be doing pap smears just yet. And right? And the reason for that is because what we're checking for is HPV-induced changes, right? Okay. HPV is a virus that is sexually transmitted. So if you haven't had penetrative sex, then your cervix really should not have been exposed to HPV yet, which means that your risk of having any of those minor changes or therefore even cervical cancer becomes significantly less. So if you haven't started having sex yet, you're doing your pap smears 1 year after starting.
Okay. I'm going to mine soon,
I'm going to do it.
Like, I feel like I have to explain myself. I'm going to do it.
Okay, so that was actually one of the questions, and I was going to bring it up next because somebody said they want to hear you talk about HPV and the damages that can be caused to the cervix by HPV.
Okay, so HPV is a virus. It actually it's short for the human papilloma virus, right? Now, HPV is actually the most common STI. So the studies actually show that from you sexually active, you're going to have HPV at some point in your life. Like 90% of us, right? What's on your face?
It happened to a friend of mine and it was quite traumatic for me.
No, it's serious.
You hear me?
And the thing about HPV too is that it doesn't have any symptoms at all, right? So you goodly have it and you don't know. Now, the good thing about it is a virus. So just like how you have flu virus just like how you have coronavirus, right? So some people have coronavirus, they're what we call asymptomatic. Them don't have no cough, them don't have no cold, them don't know, so them even catch it. And their body gets rid of it and say, oh, that be gone. And that's the end of that, right? Just like that, you have some people who have HPV, they're exposed to HPV during sex, but their body kind of deal with it and say, listen there, shoo fly, don't bother us. And they move on with life and they're fine, right? Some people have coronavirus and they catch a cold. So they might get little bad feelings, fever, cough, whatever, but they ride it out and then eventually the body bounces back and then they're over it and the virus goes away. Similarly, some people have HPV, their cervix gets sick, so that's where they have those minor changes that can happen in the cervix. But sometimes your body can actually clear it and be like, all right, we're done with you now, please to press along, and the virus can come out of your body. And then you have some people who can get coronavirus, them get sick, then pop down, them end up in a hospital.
They die.
We're not going there.
Sorry. I'm just asking, like.
I think, but I never want to think me dramatic.
Too late. I'm just joking. But yeah, but they can end up in hospital. They can be very severely sick. Mm-hmm. Similarly, some people can get HPV. Their cervix can try to fight it off, fail, and they can get progressive. No minor changes can become severe changes and can ultimately become cervical cancer. All right? So that is a spectrum in which, and the problem is you don't really know what virus you're going to get, how your body going to interact with it, etc. And that's why we definitely advocate for HPV vaccination. Because HPV virus, we talk about it like it's one virus, you know. But just like how you have COVID-19 and you have the new strain now, there are actually 100 types of HPV. Some of them cause genital warts. Some of them cause cervical cancer. Some of them really cause nothing at all, to be honest with you. But because you don't know which strain you're going to get and how your body's going to interact, that's why we say vaccinate against it, so that your body will have antibodies. So when the virus comes, your cervix is well ready for it, and some proper fighters and can get rid of the virus quick time before it can cause even mild changes or worse yet, severe changes.
Okay, so I have a question. Quick.
Mm-hmm.
You do the vaccine. I think I saw you post that you do the vaccine.
Yeah, I do the vaccine. It's not cheap though, but it's worth it.
I heard the vaccine is not cheap.
How much is it? You don't mind sharing?
No, I have a problem with that. So on average, it's actually 20-something thousand. Most places you call, they're going to tell you it's $20-something thousand per dose. My own, I normally sell it for $22,000. I'm actually having a special. It's 3 doses. Well, hold on, let me talk to you about it. I see your head hurt you. But come, it's all about it.
I just hate needles. So
no, man, it's not a very big needle, but let me tell you. So it's $22,000. I'm actually having a deal right now because of cervical cancer awareness that was last month. So I'm actually giving them for $18,700. Yeah, 15%. Yeah, 15% discount. That's not bad. A little savings.
Get some money off.
Right. But it's 3 doses. If you're already sexually active, it's 3 doses. But the good thing about it is the 3 doses are spread out. So you do like 1 dose today, you do a next dose 2 months later, and then you do a last dose 4 months from that one.
Suppose somebody chop me, I'm gonna have the money for the second dose. What's I do? I just
save.
You put all that money one side, and you say, this I'm a cervix money days.
Wow.
Healthy cervix money days, and you put that down.
So they're gonna take everything that you have. I'm just saying.
No, but you're smart, girl. You're not gonna make nobody chop you, so.
We're not going. Sure.
But it's definitely worth it. I've gotten it. I've had all my sisters get it. It's a good investment.
All right.
Do you guys hear that? Invest in your cervix. That it actually makes a lot of sense, though.
It does, because it's long life, we say.
Okay, madam, is that it? Yeah, pretty much.
Increasing your quality of life.
So we're going to ask one question before we wrap up. One last question, sorry. So somebody, I'm not pronounce that name. I'm not going about the name. I think this is for me. Never mind. So
sorry.
No, because it said you.
The big male laugh jump out a while ago.
It just basically saying what, like, do you have after sex, aftercare, after sex, specific care for your vagina after sex?
Oh,
yeah. So is it like a specific thing that people are supposed to do, or is it just like tailored to whatever you want to do? I don't know. It's like the general health thing.
So okay. One of the things I always tell all my patients is please pee after sex, right? Because with all that loving and rubbing up and all of that fun stuff and all the juices flowing and whatnot, a lot of bacteria is involved, right? Because a lot of that stuff, a lot of the bacteria even from the back by the rectum can come forward to the vagina. It can come all the way up to the urethra, which is where you actually pass your urine from. And those little bacteria can start creeping their little way up. So when you finish having sex and you have a little cuddle session for a couple minutes, just kind of ease yourself out for a second and go to the bathroom. And what you do by doing that is that you flush out the urethra so that you can prevent against urinary tract infections. Okay? Also, just good general hygiene and vaginal care. And you kind of have to know your body, right? So similarly, just like on the skin on our face, some people, them not have to care about their skin on their face. They just have good skin from morning. They don't have to put on any excess products or anything like that. Whereas some people will have to be very careful about what we put on because we're very sensitive and will react. Similarly, you have to know your vagina. Some people can have sex and not have any issues afterwards, but other people may need to actually go and bathe afterwards, wipe off the area properly, etc., because either the latex is an irritant for them,
Yeah,
or maybe the actual semen can be an irritant for them, etc. And then also, if you are having sex without a barrier method of contraception and you're having semen deposited in you, you need to be careful, because remember, what goes up must come down. And so that is going to constantly have a little bit of, little drippings afterwards, right? So you want to make sure to keep the area dry. It's a real talk.
Yeah, but you only said drippings.
Oh, I'm sorry.
That was funny.
Right? But so you want to be careful afterwards for the next couple of days or so to not sit in that excess moisture. So a serious thing I talk.
The sex thing are complicated enough, so I'ma just head out.
Serious one though. But yeah, so some people might wear liners and change them frequently, different little things like that, just to make sure to not expose the vagina to undue moisture for prolonged periods of time, because that can set you up for infections. And safe sex, guys.
Yes.
That's very true.
Yes, that's what they say, man. Wrap it up. Oh, you're saying
no, they need to wrap it up.
Oh,
and we are going to wrap it up.
They need to wrap it up. I know more people who have sex without condoms than people who actually have sex with condoms. So
which is so concerning.
Yeah, some people are like, even on the internet, they're like, oh my God, you use protection. People are like, people still use condom? And I'm like,
yeah, when people said that, I'm screaming.
I'm like,
yes,
how do you not?
Condoms did not become obsolete. Like when people say people still use condom, yes,
they never stop making them, because
they
outside
stop
of
making them.
I'm not even afraid of pregnancy. I'm afraid of infections, personally. So that's why me, I gotta say, it's always there. So I try to
definitely
educate the people that are around.
I hear Netanya out.
No,
I'm definitely afraid of children.
I'm also afraid of children.
Oh, no. Okay.
However,
I thought that you were saying that you're welcoming them. So man say it's your budget for me.
The baby than have my vagina, because when my vagina is uncomfortable, I'm naturally uncomfortable.
Yeah,
so
when my chocho isn't, I feel away. So
yes, I can understand that all too well. But I try to educate the people that are around me.
Me
like
too.
My cousins and stuff, as best as I can, about using them, because at first they're
when people ask me sexual questions, I try to answer because I feel like sex is just an uncomfortable topic. So that when people come and ask you sexual questions, it's like
they feel weird.
I forgot to help them, because it probably took a lot for them to ask you,
True. And
it takes a lot for people to ask you.
And they might not have another source of information.
Exactly.
And the other source of information may not be very good.
So you
just have to talk to them, and also just be real. Because yes, we know you're supposed to use a condom, and I definitely promote condom use. But if you're not using a condom, okay, that's a fine. You made that decision. But we have to make sure you're not get pregnant either. You understand?
Yeah,
and have
exactly. It's a real
care.
conversation for real. So other than just the cookie cutter stuff, like yes, make sure you're using a condom when you're having sex, because you want to stay safe. You have to have also the real conversation
as well. And that's a friendly fact. And that's all the time that we have, guys. This was very informative, and I'm going to think about enough things because my mind is blown. But thank you so much, Kiri, for coming on.
Thank you for having me. I hope you guys do find it beneficial, and I hope the rest of you guys do too.
Yes. You can tell them where they can find on social media.
Alright, so you can find me at Dr. Bridgewater, OBGYN, and all my locations are posted there. So come through.
You hear that, Daniel?
I see a pap smear in my fish. Like very close, yes.
So guys, remember to subscribe to the channel. Everybody's links will be down below in the description box, and just comment about anything that you've learned, and safe sex, happy sex. Sorry,
good sex.
Any sex,
good sex.
Very
important. And watch the ads. We're in our bag.
That's on period.
Yeah. So
bye.
Hi guys.